Welcome to the New England Journal of Medicine at the annual meeting of the European Society of Cardiology. I'm Stephen Morrissey, Executive Managing Editor, and I'm talking with Deputy Editor Jane Leopold and Editor-in-Chief Eric Rubin. We're looking at the RESHAPE-HF trial, transcatheter valve repair in heart failure with moderate to severe mitral regurgitation. There's been a lot of interest in transcatheter repair of the mitral valve. Jane, what was the question asked in this study?
So in this study, the investigators asked whether transcatheter mitral valve repair or transcatheter edge-to-edge repair, known as TEER, improves outcomes for patients with heart failure and heart failure with moderate to severe functional mitral regurgitation.
Eric, how did the study work and what were the results?
This included patients with heart failure who met criteria for either moderate or severe functional MR. And they were randomized to receive both transcatheter mitral valve repair and optimal medical therapy or medical therapy alone. There were three primary endpoints: the total number of heart failure-related hospitalizations in the first 2 years, hospitalizations and cardiovascular death in the first 2 years, and the change from baseline in a measure of symptomatology, the Kansas City Cardiomyopathy Questionnaire. The trial enrolled more than 500 participants. Among those randomized to transcatheter repair, the vast majority had successful procedures. And the answer, for all three measures, those who underwent the MV repair had improved outcomes.
This trial enrolled patients with less severe functional mitral regurgitation than two previous trials. So, Jane, should we be thinking about sending these patients for transcatheter valve repair?
That was the interesting thing about this trial. They enrolled a subset of patients who actually had moderate functional mitral regurgitation. And this is a group of patients that were not really included in the other two trials. Now, the study was not designed specifically to look at that group, but it's interesting to know that when they are included in the group, that the results still favor transcatheter edge-to-edge repair. So we don't know the answer to that question for certain, but it's encouraging to see these patients included in this population, and we really look forward to future trials trying to examine whether or not this procedure should be applied to these patients.
Well, I guess I've got the flip side question. Who are the patients right now who have MR and heart failure who shouldn't undergo this procedure?
Well, that would be patients who are eligible for surgery. So, we would send those patients if they had another indication for surgery, and they would have a mitral valve repair or replacement at that time. And then we also don't know the results of this procedure in patients who are even at lower risk. All of that will need to be determined in the future. But just as we learned from TAVI in patients who were not surgical candidates to patients who were at moderate risk to patients who were low risk, we will learn about this procedure as well.
Thank you, Jane, and thank you, Eric. This study was just published at NEJM.org.